Welcome back. Professor Isaac Adewole, the Minister of Health, joins us next to give, we'll get his perspective on what they're doing about curbing the spread of Lassa fever. Morning, Honorable Minister, and thank you for joining us today. Well, straight away, let's get your, because we do know there's a meeting scheduled for tomorrow, but immediately, what is going on about curbing the spread of Lassa fever?
Well, thank you so much for your support in our effort to promote nationwide alert with respect to the current outbreak of Lassa fever in the country. We are currently networking with all the states, and we've dispatched our surveillance teams all over to break what we have now realized to be a culture of silence, or in fact, someone might even say a conspiracy of silence across the country to keep down the figures. Over the last couple of days, we uncovered 5 new cases in Ebonyi State, which actually were not reported to us. But so we're meeting the commissioners of health tomorrow under the auspices of the National Council on Health. We will be able to compare notes. And we also want to appreciate Lagos State that has activated the entire spectrum of prevention and control activities, ranging from alert to early case detection, treatment, and also to ensure that everyone is on the same page with respect to this epidemic. We have also dispatched drugs to the states, and we are reactivating all our treatment and diagnostic centers in order to ensure that we are able to make diagnosis promptly.
Professor Adewole, it's very important here that no one prunes down or, well, kills any kind of story like that. Stories are reported of any outbreak or cases in places. How well have you been able to liaise with these states, maybe Commissioner of Health in across the country, so that such cases are not taken out of, should I say, it doesn't escape the eyes of the Federal Minister of Health?
Yeah, we're in touch with all the commissioners of health, as well as in touch with surveillance teams. As I've said, we are going to meet with all the commissioners tomorrow.
In the
Not
case
only
of,
the commissioners.
In the case of Ebonyi State, sorry to cut you there. In the case of Ebonyi State, you just told us that 5 new cases have been reported.
Well, they're actually uncovered, not reported, because they were actually uncovered by our surveillance team, not reported. We uncovered it. And we are also sending teams all over the states to ensure that we uncover cases that hitherto were not reported.
So for cases that are not reported, how do we help as citizens in reporting some of these cases, just in case they never made it to the hospital?
Well, what we will activate will be community surveillance. That's exactly what broke down across the country. Where we have a functional community surveillance, we will get to know right from the community level. I'm sure you heard of what happened in Niger State, where we could describe vividly this breakdown in community surveillance. It took 17 lives before we could be alert to the situation in Niger State.
Now, Prof, some people will say that it would seem that we've dropped the ball since, the outbreak of Ebola virus, because it would seem that we did handle the Ebola virus. Why do you think this is happening with Lassa?
Well, I think the first thing is, over the years, we have stayed with Lassa. And Lassa is endemic in Nigeria as against the situation with Ebola. But what is happening now is that we are bringing it to light, we are alerting the nation, because we do not consider Lassa fever to be a normal thing, even though it is endemic. So every case that we're able to pick, we will alert this nation that there is an outbreak. Over the years, as I've said, we have lived in quote with Lassa fever. The worst outbreak was in 2012, where we had about 1,700 cases. Last year, we had about 440 cases of suspected Lassa fever. But this year, we have continued to monitor the situation, And since January, we have uncovered 34 cases with 9 deaths. And the current outbreak can be traced back to August 2015. We got to the peak in December with 87 cases and 44 deaths, of which 17 of them took place in Niger State. We are also being careful. I think there's a lot of awareness about this disease, but people are also scared that this could be Ebola. But we want to assure them that we have capability to test for the 5 hemorrhagic fevers, of which Ebola and Lassa fever are part of. So what we want to assure the nation is that the current outbreak is Lassa fever. Lassa fever is treatable. We have the drugs, and we only need to pick them very early. Once we pick them early, we'll put them on drugs and they'll get well.
Why do you think, sorry to interrupt you, Chairman, but why do you think that states would like to hide if they have a case of Lassa fever?
Well, I think there is some people will want to consider it as a sign of failure. I will tell you, in Oyo State, we had a culture of denial. When I met the executive governor of Oyo State, he was angry that he would not want anybody to deny the existence of a case of Lassa fever in Oyo State, but that he would to forward to him a proposal for active case finding and prevention across the state. To me, that is an excellent case of a governor who is ready to do something. So I think at professional level, people must just admit that an outbreak should not be considered as a fault in the system, but as something to be reported and actively to be prevented.
So how is the awareness now? Because you spoke about the team that uncovered it. Are they all over the country?
Well, we will continue to work across the country. The Honorable Minister of Information and Culture is supporting us, and very soon there will be jingles, even on NTA National Network, which we think will be helpful. Tomorrow, we will meet with the commissioners. But let me also say that even channels should be commended. You have actively promoted a culture of improved awareness with respect to Lassa. The interview I had with one of your staff, Bengashiru, has been repeated in different forms over the last couple of days. This is excellent contribution to the health of this nation, to the promotion of the health of.
So could you then tell us, I mean, there are communities that actually eat rats. What are you doing about them?
It's interesting. We will advise them to stay away from rats. There are other sources of protein. Beef is one of them. Goat is one of them. So I think we can do away with rats. They contain very little protein anyway.
You've talked about staying away from rats. Some people will say, what about bush rats? I mean, we've eaten them since we can remember.
Let me say clearly that it's not every rat that is a host to Mastomys natalensis, which is that is host to Lassa fever virus. There is a particular rat which we call Mastomys natalensis. This is the rat with multiple breasts and a long tail. Is the rat that is dangerous. But because many people will not be able to identify which one is Mastomys and which one is not, we will advise people to keep away rats from their surroundings. Let us block all the hosts. Let us avoid keeping food stuff on the floor and around surroundings. Let us clear our refuse dumps so that we will not attract these rats. We should also stop bush burning. And what we'll do differently this year is that right from June, July, we will alert the nation that dry season is coming and these rats will move near our home. Please keep them away.
What exactly are we not doing right here? Because it would seem as if this is the first time for some people in many years they're getting to see that this is moving from state to state. Once upon a time, we know some places where this is endemic, but now Lagos, Benin.
From our radar, 9 states are endemic. But let me show you that in 2012, we had outbreaks in 26 states. So this is just a little component, or this is very small compared to 2012, even compared to 2013, 14, and even last year. What we are doing differently is that we are speaking out. This administration will not cover an outbreak. We will alert the nation. To us, the slogan is every life counts and every death will also count.
So what do you do with information you get from state ministries of health?
I beg your pardon, what do I do with the information?
Yeah, when you get information from states...
on a minute-by-minute basis, we are really updating the data. Once there's an outbreak, we send drugs to them. We give them advice on how to manage those cases. We will also want to confirm the result. If it is positive, we will repeat it in another lab. If there is a disparity between test 1 and test 2, we will do a third one as a tiebreaker. When 2 tests are positive, we take it as the new positive. But when there is 1 positive, even while awaiting for the confirmation, we will quickly put them on medication.
You know, when information is not forthcoming, it puts fear in people. Perhaps we should start talking about the survival rate of this particular virus in humans. How can you assure the people, just in case they come to report such cases, that they're likely to survive this illness as against what we saw with Ebola?
Well, the reassurance we have for the nation is that the case fatality, when picked very early, is negligible. It is also not everybody with Lassa fever infection or Lassa fever virus infection that will come out with full-blown disease. There are quite a number of people with subclinical infection, but when you test them for antibodies, it will be positive. So the assurance is that the infection is not uniformly fatal. When we pick them very early, we will treat them successfully. And so please do not be scared to report yourself if you have fever lasting more than 2 days and that fever is not responding to the typical anti-malaria.
Is the meeting scheduled tomorrow still going ahead, or are you treating this as a national emergency?
We are taking it as a national emergency. That's why we are calling an emergency National Council on Health. But the outbreak is not a national emergency because it's actually on the decree. So,
so far, how would you assess the way, ever since you told them not to conceal any information, are they responding to you? Are they forthcoming now with information as to
they are forthcoming. I actually received a call from a doctor in Lagos last night saying, oh, I have a suspicious case. Where do I send him to? And I said, send him to Luz.
Okay. All right, Prof. We'll get across to you, especially after the meeting, so we can follow up on developments concerning this matter.
We're available 24/7.
All right, thank you very much indeed for talking to us. All right, thank you. That's Professor Isaac Adewole, Minister of Health, talking to us about what they're doing about Lassa fever, especially those communities that he says don't. It may be hard, but for now, he says don't. Well, we'll be back.
What do you find in a rat? In rat meal?
Bush rats are quite big. They're like grass cutters. I mean, I think they're called grass cutters, bush rats. I don't know. But they're usually quite huge.
You'll always have, that group of people where this kind of thing happens. They're difficult to convince, especially if it's their tradition, if it's what they've been doing. But,
and they know that rat doesn't give, they don't know, they might not know the one that gives Lassa fever, but they know the one that doesn't give Lassa fever. So, but the minister says everybody stay away from rats, whether bush or any other type of
even
rats.
bats.
Don't eat any type of rat.
They also look like rats.
Eat the more domesticated animals. Hopefully those ones don't carry anything.
What about that research that says it actually looks similar, or is it the same thing as Ebola? But I guess maybe when they have that emergency meeting, they'll discuss all of this in terms of how they intend to tackle it, what we need to do as well in terms of maybe adjusting our lifestyle also. But primary health care, I think they should speak about that too. It's also very, very important at this stage. Well, that's the show today. We thank you all for watching. We'll be back tomorrow. I'm Chamberlain Uso.
Thank you so much. Always remember to keep those hands clean.
Many thanks. And a quick one here. We should be talking about loads and loads of agencies that have their public relations department. They must be speaking out and speaking on issues. For instance, the EFCC, which we also contacted on the
DSS.
NBC matter. The DSS is another one that has hasn't been talking. We do hope that they speak to the people. This is a democracy, and you're accountable to the people. We must hear all sides. Many thanks for watching. I'm Sulaiman Alede.
Goodbye.